The year was 1978. Jimmy Carter was president. The Yankees beat the Dodgers in the World Series 4-2. An oil shortage drove gasoline prices to an unprecedented $1 a gallon. Radio stations were playing the music of Fleetwood Mac, who had the album of the year with Rumors. Garfield the Cat made his first appearance on America's comic pages. And on the south side of Birmingham, Alabama, the UAB School of Public Health was born. The project had been many years in the making, but finally the school was a reality, and Dr. Bill Bridgers was chosen to be its first dean.
There were maybe 20 accredited schools at the time when we applied for accreditation, and in mid to late 1977. And it was difficult to crack into the club. If I had known later about how complex it is to have a meaningful school of public health, I probably would have said, I don't think we can do it. We just didn't have the resources, the space, or the money. But it was an uphill battle in those early days.
Among the many hurdles Bridgers faced were classroom and office facilities that were less than ideal.
There was a building called Tidwell Hall. We called it Grungy Tidwell. It was on 20th Street, directly across from, at that time, the Central Bank. Each floor was 10,000 square feet. I was given 1/4 of one floor, and that was my entire holdings. And so the first job I had to do, in addition to trying to identify the expertise required in order to move forward on accreditation, was to begin to persuade the administration to transplant the other people occupying that building, and so that we would have room to grow the school in. And that went surprisingly well.
This is an incredible institution with remarkable faculty and staff and students. Obviously, Riles is fairly new. It is almost virtually a state-of-the-art building for the school. When I got here, we were already bursting at the seams. And I think within the next year or two, we're going to have to start looking toward building an additional building for the School of Public Health that can accommodate the research activities, the educational programs, et cetera. It's a great problem to have, actually. Within a brief period of 25 years, this has grown to be one of the strongest institutions of public health in the nation, and certainly one of the premier schools, colleges on this campus and within the state. You can't help but feel awestruck when you look at the people that were there, some of whom graduated 15, 20 years ago and traveled thousands of miles to come back for a brief reception, a chance to say hello, a chance to reconnect. That's very, very important.